for pack. Thank you, Jennifer. We've also got our chair here with pack as well, Jennifer, and then our vice chair. She's somewhere in here, gonna be. But thank you guys for joining us on this Canine Infectious Respiratory Disease webinar with Dr. Chang. So I'll do a little intro real quick, and then I will introduce her, and we'll kind of go from there. So welcome, welcome. Let me see if I can get myself together here. Okay, so just a little bit about PAC. We're just going to kind of touch base. What's PAC? Our overall mission is to bring independent testing and certification to the pet care services industry. So, majority of you guys are probably certified in here trying to get additional CEU credit. So, you probably already know a lot this, but I always love touching base on it. So then you guys can kind of voice what your certification means. Overall, we're a nonprofit organization led by a volunteer board of directors. We do independent third-party certification, and basically what that does is it validates competency through a standardized examination based on all of our industry developed standards. All of our credentials, they're industry recognized for animal care professionals, and we demonstrate knowledge, professionalism, and a commitment to excellence. Excellence. I'll get my words right here. Professionals, we get a 3-year certification and we must complete CEs to maintain that certification. And basically, we're staying current with all the evolving best practices in animal care. So, staying up to date with it all. Overall, our core values are humane pet care, so providing compassionate, safe, secure care for the pets. Animal welfare, putting animal welfare first by making decisions that promote safe, humane, and high quality care. Our other core values are following the code of ethics, acting with integrity and professionalism, and then overall professional excellence. So we're committed to lifelong learning by continuously trying to improve our knowledge, skills, and the professional standards of pet care. So, what's the value of our certification? Why get certified? Standing out in a competitive market. Who's to say that your facility is better than the next? We want to build that pet parent trust, promote safety excellence, and invest in our business's future. And then why third party certification validates our competency. We just didn't do a course to complete everything. We actually showed up, took a standardized test, passed it to say, hey, we know this. We earned it through independent standardized examination, and we demonstrate commitment to, again, the industry standards. Overall, questions with PAC, you can always email us. Feel free, email us, follow our socials, stay up to date with everything. And if you, again, have any questions, just shoot them our way. So yeah, so overall now I'm gonna turn it over to Dr. Michelle. Let me just kind of introduce her. So overall, Dr. Michelle Chang, she is a DVM, MPH, public health veterinarian at Los Angeles County Department of Public Health. She's the lead veterinarian for the animal importation response in the veterinary public health program, as well as for key aspects of rabies control and rabies exposure management. Prior to working in public health, she worked in small animal practice. She received her veterinary degree from UC Davis and both her bachelor's degree and master of public health degree from UC Berkeley. I will go ahead and turn it over to her. Now, one thing I will say is the CEU code will be at the end. And then also, if you have any questions or anything, I'll just ask you guys to comment them down in the chat. And then at the end, we'll kind of review them and touch base and ask Dr. Chang all these questions. So take it away.
Hi, thank you so much, everyone, for having me. I just want to double check everyone can see my slides.
Yep.
Yes. All right,
All
I'm going to turn off my camera just because sometimes it ends up freezing. So I'm just going to turn it off real quick and I'll turn it on when I am back. So thank you so much, everyone, for joining. We're going to be talking about canine infectious respiratory disease complex today. So, all right. So what is canine respiratory disease infection? So sorry, canine respiratory disease complex. It's also known as kennel cough, right? Also known as infectious tracheobronchitis. But what the name for it now is the Canine Infectious Respiratory Disease Complex. And it's a complex. So saying it doesn't refer to one specific infection or pathogen. It's a syndrome, right? And a lot of these bacterial or viral pathogens are considered ubiquitous, meaning that they're everywhere, right? You see them all across the United States, all across the world. And so for this complex, there can be many pathogens that can cause it, and they all cause signs that look really similar. So for the bacterial ones, we might be really familiar with Bordetella bronchoseptica, right? That's the one when you say kennel cough, most people are thinking about Bordetella. But there's also a bacteria called Mycoplasma that can be involved, or Streptococcus zooepidemicus, that one's also involved. There's also a lot of viral pathogens that can look exactly the same. So, parainfluenza, adenovirus 2, distemper, or respiratory coronavirus, those top four, there's actually a vaccine for all of these, a combo vaccine that's available. And then we also have respiratory coronavirus. I'm sorry, herpes virus 1. Europe has a vaccine, but we do not have one in the United States for it. And then there's pneumovirus. And then there's also canine influenza. Sorry. The ones with the red star reflect that a vaccine is available for these, but it is very important to understand that for canine infectious respiratory disease complex, it in itself is not a vaccine preventable condition. I would say, except for distemper, because the distemper vaccine does give sterilizing immunity. The distemper vaccine is actually a modified live vaccine, and so it is supposed to give sterilizing immunity, and it is a core vaccine. So the distemper vaccine is very, very effective. But in general, right, like there aren't vaccines for all of these. And most of the vaccines are not designed to give sterilizing immunity, right? The vaccines can help reduce shedding and decrease the severity of disease. And so some people will say, like, well, why give it? Because, it doesn't protect them completely. But it makes a huge difference in outbreak situations, right? If you have a situation where you reduce the amount of shedding, that means fewer dogs can have it. And for a decrease in severity of disease, that's extremely important too, right? Because now you're not going to, in a boarding situation, for example, you don't want a situation where multiple dogs have to go to the veterinarian and you're stuck with the situation. Also, co-infections with multiple pathogens is very common, right? So we can see a dog end up having like Bordetella, Mycoplasma, and pneumovirus, or they can have canine flu and Bordetella. I put a lot of the resources. There's one slide for all the resources I used, but this particular resource by Reagan and Sykes is excellent. They actually have a chart about each of these bacterial or viral pathogens, and it's a chart that tells you all about them. So I really like this paper. So this is a complex, right? Where, like I said, the bacteria and the virus all of these can cause the same symptoms. So the most classic case is like you have this acute onset of just respiratory signs that can include coughing. Sometimes it can be like that honking cough that people will talk about. You can see discharge from the eyes or the nose and the nose. Some dogs will have sneezing. You can have dogs that have decreased energy, decreased appetite. Some of them can get a fever. It can end up being pneumonia. The good news is that most healthy dogs, they generally have mild clinical signs, right? Where a lot of us will be like, yeah, I think he just has kennel cough, right? However, very serious cases do occur in dogs, and dogs do die from this complex. So, particularly puppies, senior dogs, immunosuppressed dogs, or potentially, your brachycephalic breeds who already have a hard time breathing, right? If they have a respiratory infection, it makes it even harder. I have seen a dog end up with severe pneumonia and die from just a Bordetella infection. And I remember that. And definitely just saying, like, it's just kennel cough does not give enough respect to this syndrome. So, how is it spread, right? This is a respiratory issue. So, dogs spread it to other dogs. by air, right? So coughing, barking, sneezing, right? It's dispersing the bacteria and viruses into the air that other dogs can breathe. You have direct contact, right? Nose to nose contact. And something that really spreads it would be your fomites. So your toys, your bowls, kennel surfaces, equipment, contaminated surfaces. And we've seen a lot of the times employees, right? They'll work with a sick dog and then work with healthy dogs on their shoes or their clothes. So it's just like any other respiratory disease that we might see in people too, right? Like all of those things apply. So for diagnostics for this, it's really important that veterinarians start with a really good history and a physical exam. Usually, we do see that the history will include exposure to other dogs, right? A lot of the times they'll say boarding or grooming or a dog park. It is important to know that without tests, it is impossible to figure out which bacteria or virus or combinations of pathogens is responsible. So sometimes if a dog, is otherwise really healthy, veterinarians may not do a diagnostic test to figure it out, and the dog's healthy enough that they may not even need to do treatment. However, if you have a situation like in a group setting where many dogs are sick, even if they're not needing to be hospitalized, it would be important for your facilities to do some testing because you do want to know what is causing it, so that if other dogs get sick, you can kind of expect, like, okay, can some of these dogs get antibiotics if they get really sick? Or are we dealing with a virus? Do my cleaning solutions, help kill these pathogens? So PCR, a respiratory PCR, is the most practical and widely used diagnostic. However, it can be very expensive, right? These can be upwards of $200, $250, $300, depending on where you are. I know in Los Angeles, I think it's $280. There's also culture and sensitivity. You can use serology, virus isolation, and histopathology. Those are things later on. Most veterinarians are going to choose to do the PCR test, and then it will test for multiple pathogens at one time. But again, without doing these tests, you can't just look and say, like, oh, he's coughing more, so it's probably this, or the cough sounds like it's honking, so it's probably like this, or I don't see nasal discharge, so it can't be that. You can't make that assessment. So, for treatment, right, there are a lot of uncomplicated cases where the dog is still bright, alert, eating, the dog's happy, right? The dog's otherwise doing just fine. He just maybe has like a little bit of discharge or just a little bit of coughing. And in those cases, no specific treatment may be needed. Maybe a little bit of supportive care if needed, but some dogs, it will just clinically resolve and they don't necessarily need anything. However, where cases where a dog has a fever, it can develop into this. Like the dog will end up having a fever. You'll start seeing that the dog is lethargic, has a decreased appetite, signs of pneumonia, or the symptoms are just not going away for a long time. It's really important for your veterinarian to do more diagnostic testing and to treat, which can include things like antibiotic or supportive care, right? Nutritional support, fluid support, making sure they're not dehydrated. Dogs can end up needing oxygen. And again, you really need to worry about these younger dogs, your older dogs, dogs that are immunocompromised, unvaccinated animals, or animals that have multiple diseases going on. They may be at risk for more severe disease. And especially, like I said, some of your like French bulldogs, and dogs that already are having a hard time breathing. So there's a lot of things that people can do to prevent or to control outbreaks in these infections. I listed a few, and I'm going to talk about this in a few slides because I'm going to talk about flu first, but just in general, the biggest thing for prevention and control is that people need to have a plan, right? You need to have a plan for your facility. Other things just include that I'll go through about decreasing crowding and stress, increasing ventilation, right? If it's being carried through air, if you can get more fresh air in there, you're going to dilute out the bad air. You have vaccinations, really training staff, educating clients, knowing how to isolate sick animals or quarantining exposed animals, promptly treating sick animals when it's indicated, and how to do proper environmental decontamination. So again, at the end, after a few of these slides, I will go into each one in more detail. Everyone will also have access to a copy of these slides as well. So first, we're just going to talk a little bit more about canine influenza in general. So for influenza virus, there are four types of flu viruses, and this applies to animals and humans, right? So there's influenza A, B, C, and D. Influenza A is the only flu virus that causes pandemics. So that's in humans, and the influenza A can affect humans, birds, dogs, pigs, horses, cats, seals, cows, whales. Like with this new, if you guys have heard of the bird flu right now, right? We are seeing polar bears get sick. Like influenza A can affect multiple species. Not only can it affect multiple species, it can also start mixing and mutating, which is why we're very scared because that's how it can cause pandemics. So the canine influenza is an influenza A subtype. All influenza viruses are enveloped viruses. That means they have that fatty outer layer, which makes them easier to kill. So other things besides flu that are enveloped would also be the rabies virus is enveloped, and also COVID was enveloped. And so it's easier to kill, meaning that it is susceptible to a lot of disinfectants and detergents, including soap, right? So things like your Lysols, your bleach, your Clorox, anything that you use during COVID to clean things, it's going to be effective towards flu as well. Something like parvo, though, right, is not enveloped, and it's a lot harder to kill that. And so flu is identified by these surface proteins, and that's why you'll always see like avian flu, H5N1, canine influenza, H3N2, right? And that's just the surface proteins and the subtype that it is. Wild waterfowl, right, like your duck and your geese, these are the natural reservoir for all subtypes of influenza A. What does that mean? It means all of your influenza A flu viruses originated in birds and then they jumped into other species later on. So all your influenza A viruses all originated in birds, and birds do carry multiple flu viruses naturally. They're your natural reservoir. So, canine influenza, we have seen two types of it in the United States. There was H3N8, right? That was the one that originated in birds. It jumped into horses. And then in 2004, it adapted to spread in dogs, right? So it was first discovered in Florida in the mid 2000s. And basically, the virus jumped from horses into dogs, adapted into dogs, right? And as of 2016, we actually consider the canine influenza H3N8 variant as no longer circulating in the United States and is considered extinct. Horses still have their equine H3N8, but in order for it to go from horses to dogs again, it does need to make that jump and the adaptation to be able to spread amongst dogs. So again, that H3N8 is considered extinct. I know there's going to be some questions about which vaccine to give then. H3N2 is the one that we see now, and that originated in birds and then jumped into dogs and is now adapted into dogs. So it was first discovered in South Korea in about the mid 2000s, and it's now considered the primary strain across the world. It was first imported into the United States in April 2015 in the Chicago area, and this is the one where it caused a huge outbreak at one of their shelters. One important thing to know is that H3N2 flu is actually not considered endemic in the United States. What happens that's a little different is that usually what happens is there's an introduction of the virus through a dog importation event, right? Like canine flu is truly endemic in other parts of the world, like Asia. And so through moving dogs, you'll have an introduction. They cause explosive outbreaks because most dogs are not vaccinated for canine flu in the United States. Canine flu H3N2 also has a super long shedding period. So you get the introduction, you get this huge outbreak, and then it fades out, right? The dogs that were affected start becoming immune. and then it causes the large outbreak. It does its thing, and then it fades out, and you don't see it again until another introduction of an imported dog that has it comes back in, and then it repeats. You have an explosive outbreak, and it fades out. So canine flu H3N2 is a bigger deal because if you look at H3N8, we knew that the old flu, they were infectious and could spread the virus and contagious 2 days before the symptoms started and about 4 to 10 days after, right? So you knew like, hey, your dog really needs to stay home for, a couple weeks. For H3N2, it is different because they can be contagious 2 days before symptoms start and up to 3 to 4 weeks after, right? So you're asking people to isolate their dogs away from other dogs for a month, right? It is way harder for people to isolate their dogs for a month versus 2 weeks. And then to complicate situations, there are some dogs that are asymptomatic, that they can be contagious and they just never show any signs. So, is there a vaccine? Yes, there's a vaccine actually for both of them. They're considered killed vaccines, unlike distemper vaccine, which is a modified live virus. That's why it's able to cause sterilizing immunity. The influenza vaccines are killed vaccines. So you have a monovalent, right, which is just H3N2, or the bivalent one, which is H3N8 plus H3N2. Both of these vaccines are still available in the United States. I did say H3N8 is considered extinct. For us in public health and our recommendations is we actually don't mind whichever one you use, depending on cost, as long as it has H3N2. I'm completely fine if you guys continue to use the bivalent vaccine if that's available. It doesn't hurt to get the other H3N8 as well. It just needs to have H3N2 in it. So the canine influenza vaccine for H3N2, it is a little harder as well to give because to start a dog on it, 2 doses are needed to start, right? So you give one, and then they have to come back 3 to 4 weeks later, and then they have to get an annual booster. So they should also get it at least 2 weeks prior to boarding. So, right, that means you have to finish the 2 doses before. So people really have to plan. You really have to plan like over a month, like a month and a half to really start this series before you board. And some people don't necessarily think of that when they have vacation plans. Also, what I've noticed in Los Angeles is that the canine flu vaccine is actually quite expensive. And then because there can be explosive outbreaks in other parts of the nation, you oftentimes will see geographic shortages, right? People are just like, we can't find it anymore. And it's because, another state is having a huge outbreak and they're using all of it. Also to note, H3N2 vaccine, it hasn't been updated for a really long time, right? So is it still just as effective? Those are some questions for the manufacturer. They do still think that it is. And the biggest thing is like we have to remember it doesn't give sterilizing immunity, right? So even if every dog is perfectly vaccinated, if it's introduced in a group setting, dogs will get sick, right? There are going to be dogs that get flu, but it really reduces and prevents the severe disease lung lesions. It can decrease shedding. And if you think about that, right, you can shorten an outbreak that's really explosive. So, how often are these imported events, right? If I'm saying it's just getting reintroduced. So, canine influenza is not a mandated reportable disease on a federal level. So, no one's actually taking, no one knows, right? Usually, when people talk about it, it's because they find it in their shelter. It's a big deal, and they're like, yeah, we tested it and it's canine flu. So, reporting really widely varies based on your state and your local jurisdiction. For Los Angeles County, it is considered a reportable disease and it is heavily monitored by us because of our shelter system. We are very worried if it gets into our shelter system, we can really have an explosive outbreak. So this link right here, this is just our LA County Canine Influenza website, and it will list out all the cases that we know about with a lot of details. So just wanted to highlight from July 2021 to July 2022. This is the one that was in the news. It was the largest canine influenza outbreak in Los Angeles County history. These are an undercount, right? These are just people that actually reported to us. For sure, there were other dogs and people never reported, but we got over 1,000 cases. 85% of the cases were associated with group settings. And so we had asked people to list out, like, where had your dogs gone? It resulted in 21 deaths of dogs, and Traceback revealed the virus was associated with a group of imported dogs from China. And then from June 2024 to August 2025, I just pulled out our most recent cases. We had instances of canine influenza that were imported, so 6 separate shipments. And the rapid reporting of these cases led to a rapid quarantine and isolation, preventing community spread, right? So the kennels were the ones that were like, we found it. It is here, and they went on lockdown, and they had a plan because we had worked on it with them. So no other dog in our community. So we did not have a community spread. It was just within that kennel. And they were very labor intensive for kennels that housed these dogs. And I would say that so at these kennels, the canine H3N2 flu vaccine is required. And from seeing these kennels that receive these dogs, these imported dogs, from the first explosive event in 2021, where they were seeing deaths, they were taking dogs to the veterinarian, to the later cases. Some of the ones, right, it didn't go through the entire kennel. The dogs were vaccinated. So some dogs definitely didn't get it. And the ones that did get it that were vaccinated, no other dog had to go to the hospital, right? The other dogs that were boarding didn't have to go to the hospital, and they just had very mild coughs for a few days. So it was a very big difference compared to what their first outbreak looked like. And so our kennels here very much still require the canine flu vaccine because of the difference that they did make. I think it is very, very important, though, that you guys know that the vaccine doesn't prevent the outbreak completely. Dogs will still get sick, but the difference is going to be, hey, like, he just has a little bit of the cough, but he's otherwise going to be okay, versus like, you guys are now calling owners, you guys are taking dogs to the emergency room. So this is just kind of what our website looks like. So you can go under like the overview. We tell vets to report, and if they need consults, we have guidance by audience. So for animal owners and for veterinarians. And then if you click on this, it'll take you down over here where it will have a brief paragraph about every imported incident that we know of. And so some people are like, well, how often does it happen, right? Like I told you guys, like, just in the last couple years, we had 6 separate incidences. So it's not that rare. It's not rare for LA County, right? We really monitor it a lot. But if you look at the news any other time and just kind of do like dog flu, canine flu, like, this really proves that it does cause very explosive outbreaks where your shelters have to pause dog intakes, things have to close for a while. It is a very hard time. This canine flu outbreaks puts this facility in crisis mode, right? This is what is happening. So, in most of these facilities don't require the vaccine if, you're a shelter taking in these dogs. So it is important to know, like, it's all around the states. It's not just certain states. Because when dogs are imported into the United States and they're imported as a group, these dogs do end up going to multiple states, right? We have dogs that enter through LAX airport, but then they're supposed to go to 7 other states. It's just like with those dogs that had rabies, right? They become multi-state outbreaks because these dogs in these big shipments end up going to multiple states. So should we be worried? I say absolutely yes. And why is that? So most dogs are not vaccinated in the United States, right? And there's multiple reasons why. First, right, it's 2 doses of the vaccine to start, then you need a yearly booster. It's kind of an expensive vaccine, right? Like, veterinarians had told us, like, this is an expensive vaccine to carry, and then it's also expensive to give, right? Like, Right now in LA, it's $60 per dose to get. So, you're starting off with two doses and then you have to do it every year. Plus, if you're charged an exam fee, things like that, it really adds up. There's regional shortages, right? You might, even if people want it, they can't get it. So it can make it really difficult to require the vaccine. I am also worried because, like I said, the outbreak events are very, very explosive. You should expect your entire facility to get it. And some dogs get very, very sick. The other thing is that, like I said, it's a really long shedding period, right? Dogs are contagious from 2 days before symptoms up to 28 days. And this makes the outbreak control really, really difficult, right? Because these dogs are going to be sick for a while. And even if they look like they're recovering, they're still shedding. The other concern is canine influenza zoonotic? Zoonotic means is it transmission, can it jump from dogs to humans? So we do know that cats can rarely be infected, but there are documented cases of canine flu going into cats. Currently, we don't think canine flu is zoonotic, so we don't think it jumps into humans. However, dogs, like any other species, like pigs, for example, right? We always talk about pigs. They can be mixing vessels to create new flu strains that could affect humans. Also, there is research in Asia that has also demonstrated that there are mutations in the canine influenza H3 and 2 that can lead to the virus adapting into humans. And this is a really big concern, right? And they've also found that it has mutated and there's a novel H3N6 now in dogs as well. And so we don't have a vaccine for that. What is that going to look like? So this is a video that I'm going to show. This is of a very healthy 2-year-old golden retriever that otherwise didn't have any problems. This was brought in with a couple other golden retrievers, and I think there were 4 or 5 dogs, and the other dogs, all of them had canine flu, and a couple of them were completely fine, right? Just coughing a little bit here and there, but still jumping up and down. And then this happened with one of the dogs. And so this dog ended up having pneumonia, and this was right before they took the dog to the veterinarian, and the dog had to stay and ended up having needing oxygen as well, and had pretty severe pneumonia. But you wouldn't necessarily expect this, right? Like it's a 2-year-old, really healthy dog. It doesn't have a squished face like a French bulldog, and its other friends that came with it were doing totally fine. But this dog had severe disease. This is just a paper that they did show. Like there is an emergence of a novel reassortant H3N6 canine influenza virus, right, that dogs can get. They also showed that in addition to this new H3N6, right, because we have H3N2, it showed increased mammalian adaptation ability, meaning like, can it actually affect humans? That would be incredibly scary because look at the way that our relationship is with our dogs, right? Like we kiss our dogs, we sleep with the dogs, everything like that, right? Like we're always around our dogs. If there is a virus that jumps from dogs to humans, like flu, and then human to human, that is the start of a potential pandemic. So, all right, going back to prevention and control strategies. So the biggest thing is to really have a plan and be prepared, right? Because for canine infectious respiratory disease complex, like everyone here has seen it in their lives if you've worked with dogs, right? Like you've seen it to some extent. Maybe it wasn't that serious, maybe it was serious. But it's really important to first just have a plan and assume the situation will happen. Because if you just assume the situation will happen, then you can start having a plan. So training your staff and educating your clients, right? So for veterinary hospitals, we literally tell them, do not allow coughing dogs into the common space in your practice, right? Use signage asking owners to notify you if they do have a coughing dog that's coming in, and to immediately move them into an exam room, or if it's like not hot outside, have the owner wait with the car outside, and then the vet can do testing outside, right? And wear all of their protective equipment. And so staff that are making the appointment, if they hear that a dog is coughing and that's what the appointment is for, right? They should be able to know, like, okay, we are already going to tell them, go into room 4 immediately, or just stay in your car. And vets really should take a good history and ask about travel history and any time the dog spent in like a congregate group setting. And everyone needs to use personal protective equipment and know how to decontaminate the environment yourself, right? In some of these, in our explosive outbreak in 2021, vets ended up bringing it home to their dogs on their scrubs. And then, so for your congregate settings like your daycare, your boarding facilities, grooming, right? Really discuss what the signs are of canine respiratory disease complex with staff. Make sure your staff can have a questionnaire to ask pet owners before appointments, before they start boarding. And then at drop off, train your staff to look for symptoms and to say something, right? If you see a cough, if you see that the dog's sneezing, if you see that there is, goopy eyes and nose, say something to someone about it. And so, more about having the plan, right? That staff education is really important. If you see something, you need to say something. Your staff should also use protective equipment. They should know the order of disinfection, right? If you do have an outbreak, for example, if you have an outbreak, people don't necessarily think about it. They just know they need to clean rooms. Well, should you clean the dirty room first that has infected animals, or should you clean the room where the animals are not sick? Should you clean the room that has housing, the older animals or the puppies first, right? There's an order where you want to go clean to dirty. Sometimes in outbreaks, the staff, there, you'll actually have kennels do dedicated staff per area, and they use a bunch of signs that will literally have the names of the staff that are allowed in those rooms, and other staff can't enter those rooms. That way, you don't cross contaminate. Other things you need to think about is how will you notify owners, right? And during these outbreaks, what we saw was people went crazy on Google reviews and Yelp, right? They really tore into these kennels saying that they're dirty and things like that. So, talking about how you're going to communicate with your owners is very important because it's your reputation as well. Other things, right? Do you actually have an isolation area for your six dogs, like a dedicated kennel, a dedicated area? Because, for example, if a person comes in at drop off and the animal is sick, and you're like, well, I don't want to say no, and they're literally on the way to the airport, what are they going to do? Is there an area that you can actually put this dog separately from the others so that if it ends up being sick, it's not going to get the other animal sick? And that's, it doesn't, you're just, your isolation area just needs to be an area away from the other dogs, and where a person working with the sick dog is not going to work with your healthy dogs. Other things to consider in your plan. If an outbreak happens, right? Are you going to close down to clean? Will you stop accepting animals? Like, we had kennels that didn't want to do that. And because they're businesses, we understand that, right? But what are the control strategies that you will use when this happens? And that's a conversation to have with your staff. For the kennels that we have here that have the imported animals, the imported animals are in a completely separate area, and the staff that work with them are completely separate, and there's a separate airflow for them. And then, what is your plan for a very sick animal who needs veterinary care immediately, right? Is it in the agreement with your owners that, hey, if this happens, we are taking them to, the emergency room and you have to pay for this? Like, what is the agreement with your owners? Like, these are all things to consider. Other things would be just decreasing crowding and stress, right? Is it possible if you're not completely full that you can separate dogs and use every other kennel to, spread them out, right? Like if a cough can't necessarily reach the other dog, it's less likely the other dog is gonna, get a certain disease. How big are your play or your training groups, right? More dogs, more disease. If you have little cohorts of dogs instead, that can help control disease as well. Do you make dogs do a quarantine period before they join a new group? Things to consider. Increasing ventilation, right? If you can mix clean air and flow out the bad air, are the activities that you do indoor versus outdoors? How can you maximize fresh air? Can you use fans? Can you open windows? All things to consider. And then, of course, vaccination, right? Again, it's important to understand that for canine infectious respiratory disease complex, Vaccines do not completely prevent the disease, except for distemper. It does have sterilizing immunity, and that's why the distemper vaccine is amazing. But owners need to understand that, right? Because if you, for example, if your facility is going to do a vaccine clinic, it's really important that they need to know that it's not going to completely prevent the disease. And the reason you do it is because it really does help prevent serious illness, and it does make a really big difference in an outbreak situation. And dogs themselves will benefit if they do not get serious disease. And if you are requiring the vaccines, is your staff actually checking to make sure that these dogs are getting boosters and they're up to date? I know some people may have dogs that board with them all the time and the owner's great, and you just assume that the owner, does what they do and will definitely get their dog boosters because they're responsible. But you know what? Sometimes we just forget, right? And a dog can lapse in their vaccine. And then and isolating sick animals or quarantining exposed animals, like what does that mean, right? So, in order to do that, your facility actually has to have different spaces, right? Sick animals should be separated. Animals that were exposed to the sick dogs but are not showing signs yet, they should be in another area. And then your completely healthy dog should be in another area. And like, what does that mean? It means like your staff need to literally know, like, you are walking the sick dogs into a new room that old, or keeping them in that room with other sick dogs, and other rooms can't be moved. So you have to have a strategy of like, if I'm moving sick dogs, what hallway are they moving down, and how do I disinfect this hallway before other dogs go down this hallway? So using signs at your facility is really important. Like I said, some kennels would literally put the names of staff. Like, if you are not Michelle, you cannot come into this room. There were huge signs that said, stop. You cannot enter this area. They have carts of cleaning, disinfection everywhere. Like our kennels here, they have a protocol. All of their staff know the protocol. So if there is any situation, everyone knows their role. Everyone knows what they're supposed to pull out of like the cleaning carts. Everyone knows where they're allowed to be and where they are not. And then also testing during an outbreak, right? You can't determine the pathogen causing the illness just by looking at the animal. So it's important that you do the testing to determine the cause if you're seeing a lot of dogs get sick, right? If you can do early intervention, you can also prevent a larger outbreak from happening, but you're not going to be able to do that unless you pay for testing. So we did have a kennel that ended up paying for like 5 animals to get tested with their owners approving. And the kennel actually just paid for it themselves to figure out what it was. And it wasn't canine flu. So they did feel better about that. But in general, right, that meant that potentially the dog could get antibiotics if it was indicated by their vet. And they did know that for Bordetella, for example, most of the dogs were vaccinated for that. And then for disease reporting, it's different, right, in every jurisdiction. So in my jurisdiction, it is reportable, a lot of these diseases. And when you report, you can actually talk to a veterinarian to talk about control strategies. But check if diseases are reportable in your area and see if there's someone at the public health department that can help you and guide you through an outbreak, right? Because most outbreaks are similar. It doesn't matter if it's in dogs or if it's human. The strategy is going to be similar. Like if you had a flu outbreak at a preschool or something, right? It's going to be really similar where like the sick kids need to stay home and you want to increase the airflow. A lot of these, if you think about it, are same strategies that were discussed during like COVID. And so these are all resources that I looked at. I think these are really great resources. Again, the first one I really, really like because you can look at each specific pathogen. And then these are just more general articles, but they're all really, really good and they can help you create a plan. And they're easy to read if you want to give them to your staff as well. And then this is the CEU code. And I'll just keep this up for a couple minutes. So in case anyone can't see the screen, it is CC260073.
I'll also send it in the notes too. Or
And
the
everyone will get a copy of these slides.
Yes. Thank you, Dr. Chang. I thought that was very informative. I know I had a lot of questions when I came into it, so that's kind of answered a bunch from me. We do have a question in the chat, so I'll go ahead and read that. Boarding facility. I have customers that comment, I don't get a flu vaccine for myself. I don't want to get it for my dog either. What would you say to that?
So I know the flu vaccine can be very difficult to convince owners to get because even when I used to work practice, right, it is hard to have them want to get it. Um, it is your business though, right? And so you do have the right to make those recommendations. And so for a lot of the facilities in LA that didn't require it, after the outbreak, they definitely required it because of the experience was traumatizing for them. So I feel like I don't know how helpful this is. Like as a business owner, right, you can require it and you can tell them why because it does benefit your business to not have to deal with such an explosive outbreak. But even with the human flu vaccine, I sadly know someone that passed away recently from the flu, and it was quite a shock that that happened. She was only 47 years old, and like she died of flu, and I just I I didn't expect it, right? So um I do recommend that veterinarians themselves also be vaccinated for flu, especially because a lot of veterinarians do work with birds and things, and you don't want to be a mixing vessel. And we have seen like regular seasonal flu outbreaks cause issues with staff that I would recommend it from a public health stance. And now, personally knowing someone that passed away, I believe it even more. But I am not someone that's going to push it on anyone here.
All right. Next question. Most veterinarians in our area do not require the CIV vaccine, and we are the only boarding daycare facility that currently requires the bivalent CIV vaccine for pets in our care. We are considering making this a recommendation versus a requirement because of this. What is your recommendation for boarding and daycare facilities based on the current cases of CIV in the US, specifically there on the East Coast?
Yeah, so what I actually see in the news is that a lot of the East Coast has a lot of the outbreaks. So if you look at where the dogs are being imported in from other countries, there's only like 7 animal care facilities, right? JFK is the big one. There's Atlanta. There's Miami. You guys have more states that have them. On the West Coast right now, it's only LAX, right? And I have that covered. So I know like which cases are coming in. No one is checking canine flu on the East Coast. And for problematic importers who used to import through LAX because they had such a hard time because I would quarantine their dogs, they will go through the East Coast now where nobody checks because it's easier for them to get through. So that's why a lot of the cases in the news are always on the East Coast. So for us in LA County, we don't consider canine influenza vaccine a core vaccine either, right? We specifically say for animals that are social, that go to boarding, that do play groups, parks, and things, we absolutely recommend it for them. And then the recommendation we have for businesses is we definitely highly recommend that you um, require it. But if you don't want to, you don't have to. I have personally seen it help in outbreaks, but I think it's still a business choice.
Yeah, that I mean makes sense. All right, so next one. Is there any benefit of receiving the first shot in the series but not the second?
So the manufacturers do recommend that you do have to have both, and then you have to have the booster every year. So that's going to be based on their studies for how it works the best. Plus, if it because they stand by their vaccines, if a dog does end up getting super bad illness, potentially the company can pay for some of the treatment. So everyone should know that as well. I tell vets that all the time. Like, if the vaccine says that it does this and that's the promise, and you gave it correctly, and that goes for other medications as well, right? Like if the manufacturer's promising this, you can actually call and have treatment sometimes covered. That happened with a heartworm case that we had in LA, where the company ended up having to pay for the treatment.
That's happened in where I am. I'm in
Yeah.
Kentucky. I'm an hour from Nashville. So we've had a few cases like that.
So I very much recommend what the manufacturer says, right? If you're going to do this and do it right, you need to do the 2 doses and yearly. The only confusing part is like, let's say you did the 2 doses, you did the yearly, and then you were like, I don't really want to do it anymore, and then you like didn't do it for a couple years. What most vets will do is start the dog on the 2 doses again, like completely restart, and then do the one every year after that. So it is beneficial to keep um, your dogs up to date if you're going to stay on that.
Okay, next question. For dogs that attend places like pet care facilities or dog shows regularly, is there benefit to vaccinating every 6 months?
I don't know the answer to that. I just work off what the for each specific vaccine. Like I know for Bordetella, you can give it every 6 months, depending on what the manufacturer guidance is. So if you are at higher risk and the manufacturer guidance is that you should get it every 6 months, there can definitely be a benefit since they were able to test it for that. But for the canine flu, it is the 2 series and then the two and then the one every year.
Okay. Y'all are pouring in the questions. Good job here. Okay, 2014, I had a para-influenza, and up-to-date dogs got signs and symptoms. Para was verified through LSU. Comments on this?
So it was a bird that was sick and then ended up giving it to the dogs. Is that correct? What I'm hearing? Did you,
Looks like Francis.
did
I
you,
know this one's
Yeah.
yours.
did you say parrot?
No, para. I'm sorry.
Para-influenza.
Hi. Para influenza was verified by a couple of dogs through my veterinarian. He sent the samples, what have you, I don't remember now, to LSU,
Yeah, para-influenza
right?
is a different virus than influenza. So
Right.
the para-influenza virus, there is a combo vaccine for it as well. But
Right.
like all the other pathogens, it doesn't give you sterilizing immunity, right? Distemper and the modified live virus for parvo, those are ones that are considered sterilizing immunity because these are modified live virus vaccines. Your other ones, like your Bordetella, your flus, and all the other combos, they don't give sterilizing immunity. The promise from the manufacturer is that you have decreased shedding, you're not going to have a severe disease. So it's really important for owners to know that because if you were requiring certain vaccines and you still have an outbreak, that's going to be why. And for owners who get it, right, a lot of the questions are like, well, that sounds like it's not even going to protect my dog. But I have seen it end up protecting dogs in an outbreak when dogs that would have become really sick didn't get super sick again.
Thank you.
Okay. Next up is um boarding facility. Okay. Is there any news if the US will follow and offer the herpes vaccine?
I don't know anything about that actually. Yeah.
Well, that was a quick answer.
Sorry.
Okay. When the shedding periods were shared, it was data from Univax dogs. Do we know what the shedding period reduces to with the vaccine, or is there no change?
So this is a really good question because um, I don't know if they've done, like the manufacturers have done enough of a study because for us here, when we have a canine influenza outbreak and dogs are vaccinated, right? They're vaccinated. So technically, we normally do a 28-day quarantine, right? And so usually what happens is with studies, if you're saying like, hey, if you're vaccinated and it decreases shedding, can you decrease the time from 28 to 14 or whatever, right? We have not been able to find enough verifiable studies that were independently done by like a university for us to change our requirement. But I think that is really important because one of the things that happens is that every time an outbreak does happen, every dog is still quarantined for 28 days. And then owners will end up being like, then why am I even doing this? Right? Like they're still quarantined for 28 days. So there aren't enough studies that we've been able to change our quarantine time because we are very, very strict about canine flu. Right when it went into our shelters, it really like was annihilating one of our shelters. And so we are very conservative about it. But if someone did do a study about it, I think it could decrease the. It is shown in the manufacturer of the vaccine that that is what it does, but is it verifiable from a third party?
Okay. Next question. Good afternoon. My name is Susie Monterio, and I own a dog daycare and boarding facility in Brazil. We require all dogs to be vaccinated against canine influenza, but this year we had a significant number of respiratory cases in São Paulo, even among vaccinated dogs. Currently, our protocol requires only one dose of the canine influenza vaccine. Would you recommend requiring two doses instead? Also, could you please recommend resources with detailed cleaning and disinfection protocols, including which products are most effective for daycare and boarding facilities?
So for cases in another country, right, that always makes me wonder, like, could it be a different like variant of the virus, right? Like viruses can change. Where, like I said, for the canine H3N2, that vaccine hasn't changed for like decades, right? Can there be little variations of the virus coming from different areas after it mutates that is just a little different that now the vaccine doesn't work that well, right? We see that a lot in like the human flu vaccine every year, right? They try to make it so it matches, and sometimes it's not a good match and people still get sick. So I think those are things that are important to consider, like with that canine flu vaccine, that it hasn't been updated. And some of these vaccines don't necessarily get updated. And dogs are mixing vessels from all over. So that could potentially explain it. Could potentially explain if like certain dogs just had a higher load of the virus, right? They just got more of it and they got more sick if, they had a history of being in other play areas before your business, other factors like that. In terms of cleaning, there are a lot of, I would say, Savannah, do you guys have any resources for them, like about disinfection and things like that? Because there are ones that are available. Like
Yeah,
shelters have like these
yeah.
guidances.
I know there's a bunch of different products out there, and we have a bunch of different partners through PAC. Now, there's no one I could like specifically recommend. I know like there's Health Technologies, there's Jennifer, are you still on here? I don't know if Jennifer, our chair, is still on here because oh,
Yes, I am.
I was like, you might have
As
some better insight on this.
Yeah, as far as resources go, PAC itself, we don't put out education, but like Savannah was saying, definitely reach out to places like Health Technology, Virox, all those places that you get your chemical from now would have a cleaning protocol, I'm sure. And remember also that different chemicals will have different instructions for how to use it properly, depending on specifically what pathogen you're trying to kill, such as parvo probably has a different direction for using it than, maybe some other viruses. So I'll let Dr. Chang maybe finish that thought.
And I also feel like asking like one of your municipal shelters is helpful as well, right? Because they all have to have a certain protocol. So seeing what they use, what they do can be helpful. But there are cleaning protocols that are out there for sure. Because I know in shelter medicine, they put out a lot of information that like is available online for everyone. But it's important to have at least that plan. I'm sorry,
Yeah.
I can't give you any specifics.
Okay, so UV light system in the boarding HVAC system. Do you have any insight about that?
I do not have any personal experience with that. I know that there are UV light systems that work quite well for certain pathogens. I think what the layout of your facility is makes a big difference. Our shelters here don't use that, right? Our shelters are just using your general recommended chemicals that they all use. And I think talking to the manufacturer, looking at the studies, which one would be better and more suited in cost is a good way to make those decisions.
Perfect. Okay, next one, kind of like a two-part, is CIV in the PCR test?
Yes.
Okay, and next kind of follow-up is how do you get the veterinarians on board with a boarding daycare facility when asking for testing? We've had 2 summers now of dogs primarily symptoms of sneezing. We believe we had a mild outbreak of something, but we're unable to have any of the veterinarians in town get on board with us to consider the possibility of an outbreak. It was waved off as allergies. We traced the sneezing and what groups it was affecting and found a trend to possibly prove an outbreak. We implemented protocols, reduced numbers, closed certain days, etc., and were able to stop any more spread. We were never able to get a veterinarian to agree that something more than allergies was going on and unsuccessful to get any PCRs done, even when offering to pay for it.
First of all, amazing job on like alerting someone, doing what you needed to do to get that done. That is amazing. I feel like, so another thing about just PCR testing in general, right? No testing is perfect. And there are times like even during when you do tests on a dog that's like super sick, it doesn't necessarily find anything, right? Because your testing is only as good as your sample. And there's been times where we had to test dogs multiple times where we found something. Um, it makes me very sad to hear that like a vet didn't necessarily want to test, even if you were going to pay for it. I think I've never heard that before. Like usually if you ask for a test and it has clinical signs, like, and you want to do it, PCR is not very invasive. So I'm not sure why the vet didn't want to do that. Um, yeah, I don't know. That's very odd. I feel like usually people don't want to pay for it is what is the limiting factor for why certain tests aren't done. But again, huge kudos to you for taking action and like, closing, cleaning, doing these things. That's really important. You saved a lot of lives.
Okay, so I know it's 2:04, so if anybody needs to jump off, don't feel like, you have to stay on. We're just going to finish answering questions and then kind of do a closeout. There is one more question on here. Is it possible for even vaccinated dogs to be asymptomatic? Does the influenza transmission allow included shared water bowls?
Yeah, so for asymptomatic cases of flu, I've seen data showing like up to 25% of dogs can actually be asymptomatic and like still shed the virus, right? And that's very similar to a lot of respiratory diseases. If you think about people who got COVID and didn't get COVID or flu or whatever. Some people were like, I'm totally fine and never thought they had it. And then some people got really sick. I think it can run the whole spectrum. But yes, shared water bowls, shared toys, anything where there's saliva on it, those are definitely ways that you can transmit viruses and bacteria and especially for flu.
Perfect. Now, I know I do have a question. Bordetella vaccine. Do you have a recommendation for intranasal or oral?
Yeah, so there is information about that. I'm not super familiar with the two, but that first paper that I showed you, that Dr. Sykes wrote, she
Mhm.
has a whole chart that actually talks about like the pros and cons of each, and so definitely reviewing that. I usually do the intranasal one.
Okay, awesome. One more question. So, what would be a better way to have water available in daycares other than shared water bowls?
That's a tough one, right? I know that for the kennels that we've worked with, where they have like an higher risk of certain type of diseases, they will just have multiple water bowls and just they have a lot of water bowls, and each dog has a dedicated water bowl, and that is really hard on them to do, washing and dishes and things like that. But they do things like that to make sure that they don't have outbreaks. So I think what works for you, right? Or if you have smaller cohorts of dogs, trusted groups like that and they can share a water bowl. But, sharing water bowls in general, like you see them out in public during the hot times, like they're always a risk. Bowls at your dog park are also a risk.
Yeah, so not just daycares. Um, the 25% that can be asymptomatic and still shed, was that for vaccinated population?
That I'm not sure if it was in the vaccinated or unvaccinated. It's just in general, up to 25% of dogs can be asymptomatic. We've seen that actually in a group of dogs that came in where one of the dogs was PCR positive and not showing any signs. So we were like, did this dog just have it and recover? Or is this dog a true asymptomatic? But that can be true for any of your respiratory diseases, right? There's going to be the animal or person that is your super spreader, right? And just never showed signs and you never knew. You could never identify the person, and it was that person that was spreading it to everyone.
All right. Well, I think that's all the questions we've got. I just want to say again, thank you, Dr. Chang, for presenting on this webinar today. I thought it was very educational. And I can't wait to, I'll actually probably have my staff rewatch this webinar to educate them. Do you have any closing, anything you want to say, or all good?
I'm sorry if I didn't answer some of the questions super sufficiently. If you do have other questions, though, always feel free to let Savannah know and she can get in touch with me. But
Yep.
thank you so much for attending.
Yeah. And if
Thank
you
you,
guys,
Dr. Chang.
thank you. If you guys have questions, always feel free to email info at packcert.org, and I'll put the email on here as well. But you guys have a wonderful day, and thank you for joining us.
Thank you for attending, everyone.
All right, bye.